Wellmore Behavioral Health. Wellness for a lifetime. We all want to be happy. But in today's stress-filled world, storms happen. And as the storm clouds gather, they can block out the sun and darken a life. Addiction. Abuse. Mental illness. It's easy to lose your way in the storm, but you don't have to go it alone. For more than 6 decades, Wellmore has been helping people escape their storms, helping them get back to the sunshine, back to their families, back to a healthy and fulfilling life. Let's get to know Wellmore. A large part of Western Connecticut is served by Wellmore's highly trained, skilled, and compassionate staff.
Wellmore is an agency for mental health services, not just for children, but also for adults. We have adult services, we have child services, and it ranges from individual and family work. I've been working for the Emergency Mobile Psychiatric Program, and what we do is we get calls through 211, which is our state hotline for supports, resources, and any crisis needs.
When families come in, it's definitely, there are some that are extremely desperate, very overwhelmed, I guess you could say. Families will come in and they literally state multiple times, I don't know what else to do. We've tried everything. There's nothing left. So I really do think that sometimes when families come here, they feel quite hopeful. As long as they're consistent with coming and they're, attending therapy on a regular basis, they generally leave feeling pretty hopeful about the improvements that their family makes. We get referrals through DCF, and the whole purpose of our program is that we're able to set them up and be independent and help really any risk factors that got DCF involved in the first place so that these families can be independent and no longer have to have DCF involvement in their lives. We're all here because we care to make a difference in the families' lives, and we care to help make them better and work with them in the ways that we can.
We as a community are putting on the news that we have an opiate crisis. It's all over the news that opiate levels are rising, overdoses, deaths, but yet at the same time they're talking about how can we start trimming resources and support for these individuals. So we're saying on one hand it's going up, and now on the other hand, okay, our services are starting to be depleted. And that's why I think, agencies such as ourselves is such an integral part of this in the community, because you figure if agencies like us get cut, where are these clients going to go? Where are they going to go for support when they get enough courage to actually walk through our door, to actually reach out for help? I mean, it may have taken them 6 months, maybe 6 years to get up enough courage to come in and surrender and say, I need help. And if we don't have facilities like this, where are they going to turn? And that's something that scares me is, listen, when someone's ready to break that cycle, I think it's really important for agencies such as ourselves to be there when they are ready. We provide services to all types of people in the community. I mean, listen, you go to the best neighborhood supposedly in the best part of town, and there probably is somebody struggling with addiction in that community.
As a transitional case manager, I work with inmates that are transitioning from prison back into the community who need substance abuse treatment and also support services.
I was actually an insurance agent, and I was actually an alcoholic. I fell asleep with a cigarette in my hand. I had a house fire, and a woman down in the hallway passed away by accident. Brought me to prison. First time ever in prison. I had 10 years they gave me. I really had nowhere to go when I got out of prison. I had a pair of sneakers and an old pair of jogging pants and a sweatshirt to my name. And Wellmore actually picked me up, brought me through here, and gave me a place to stay. They took me by the hand like a little kid, and I can't say enough about them. If it wasn't for them, I'd be homeless on the streets. They saved my life.
The kind of patients that we work with are individuals who may be suffering from mental health issues such as depression or disorders like bipolar disorder or attention deficit disorder. as well as adults who have similar mental health issues and issues with addiction. Care really stems from, it's not just a medicine or it's not just meeting with a therapist. It requires a whole team. And the resources that are available don't support that whole team. We have experts in medicine prescribing, we have experts in special types of therapy that are for trauma. And in order to provide the best care, whether that's case management support, whether that's individual or group therapy and medication, we all need to meet to coordinate that treatment and that care. And reimbursements don't support that. We need to do that on our own time, but we do it because it provides the highest quality of care, and the evidence shows that.
Whether you've been lost in a storm or know someone who is, Wellmore is here to help. Click Contact Us at the top of the webpage for information on how to get the help you need, the compassion you want, the wellness you deserve. Wellness for a lifetime.